I'm Oriana, the global health lead at Women at the Table and founder of FemTechnology Summit, a global movement addressing gaps in women's health. I started the summit while in medical school after witnessing firsthand the gaps in clinical education. Women at the Table was our first sponsor. Outputs of the summit have been featured at the U.S. Chamber of Commerce and the World Economic Forum, proving how convening diverse expertise drives real change. The problem is simple. We're not using the knowledge and tools we already have. Women are 20 to 30% more likely than men to be misdiagnosed, often waiting years for conditions like PCOS or endometriosis to be addressed. These delays cost billions in lost productivity and escalate into larger health risks. Why? Because we don't have clear pathways to apply the knowledge we already have, and without that, change just doesn't happen. That's why our clinical guidelines turns research and the knowledge and tools that we already have into actionable protocols, making next steps clear and connecting clinicians to tools that already exist. Our benefits leadership councils help employers redesign health policies, closing the care gaps for the 60% of US women with employer-sponsored healthcare. We hope that this, in turn, this private sector initiative will then influence public programs like Medicaid and Medicare. AI is already transforming healthcare and has the potential to do good, but without frameworks, it risks embedding the biases of the past that harm women. That's why establishing these best-in-class practices and guardrails now is essential to ensure AI delivers equitable, inclusive care at scale. And we hope you will support us in that effort.